Hi, I'm Dr. Stacy Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk today a little bit about what's the difference between osteoporosis versus osteoarthritis. I get that question asked fairly often when I see patients in the office. So osteoporosis means softening of the bones. Osteo means bone, porosis means to thin. So it's when your bones get thin or soften or they begin to weaken. Osteoarthritis is when you lose cartilage in a joint. So where the cartilage gets thinner or you start to lose that cushion that's in your knee joint. I'm just going to show you some images which will explain it a little easier. So this is a normal looking hip. This is the head of the femur. This is the shaft of the femur. This is part of the pelvis bone. This is a fractured hip or a broken hip. So there's this portion of the hip should be sitting here, and then this portion of the hip should be sitting out in this position. So this is a three-part proximal humerus fracture, and this is a classic fracture we see when patients get osteoporosis. We think what happens is their bone gets weak because of osteoporosis. They twist, the bone breaks, and then the patient will fall. This is an x-ray after a patient has undergone surgery for this type of fracture. So this is a normal looking hip. This is one with a hip fracture from osteoporosis. And this is a device that we put in hips to fix this fracture. Osteoporosis is a treatable disease. Once women hit menopause, they can lose 30% of their bone mass in the first 10 years. It's a silent disease. It tends to be silent until you break a bone. So this is something you would want to talk with your healthcare provider about getting a bone density study once you reach age 65 as a screening test. Now I'm just going to show you some images of what osteoarthritis looks like. This is a knee joint. This is your thigh bone. This is the shin bone. This is the joint space, and you can see there's a black area there, which is perfect because that means there's cartilage, no arthritis. This is an x-ray of a patient who has advanced what we call bone-on-bone arthritis, where there's no cartilage left in that knee joint at all. So there is bone contacting bone, which is very painful. So that is the difference between osteoporosis and osteoarthritis. Thank you.